unlicensed assistive personnel. Who they think that? How you guys doing? My name is Elijah, and today I'm going to be doing my teaching presentation over delegation and supervision. So I have a list of things because I'm going to be talking about a lot of different things throughout this presentation. So I have a list of things that I really want you guys to focus on. Of course, I want you to just kind of listen to the whole presentation, but really the real takeaways from this presentation, the learning objectives. I want you guys to be able to define delegation and put it in your own words and be able to explain it to someone else. I want you to list the 5 rights of delegation, define supervision, put it in your own words and be able to teach it to someone else. Name 3 people who a nurse may supervise and give 2 examples of a nurse exercising their own, delegatory autonomy. You'll understand more of what that is later. So what is delegation? To me, delegation is when a nurse assigns a nursing task, something that is within the scope of an RN, and they assign it to another person that's a part of the professional care team for a certain patient. Delegation is a really essential tool that a nurse can use because we have so many things to do in one day. So being able to delegate is a very useful skill that helps maximize the nursing care that clients receive from us. So someone that a nurse can delegate to are CNAs or PCTs. These 2 are the same thing. CNA and PCT are the same thing. Based on where you're at, they may say CNA or PCT. I know in long-term care facilities like nursing homes or assisted living facilities, they may call you a CNA or a nurse aide or just an aide. And PCT is typically used in the hospital. Don't really use it anywhere else as far as I'm concerned. Medication aides, they're typically in assisted living and long-term care facilities like nursing homes. And they call it CMAs or med aides. And basically their job is to pass meds. They take on most of the meds that they do. They can do inhaled medications like asthma inhalers or eye drops, because I know a lot of older people in the nursing homes had eye drops, and pretty much any other PO meds besides the controlled ones like alprazolam or hydrocodone. So they don't do the benzodiazepines or the opioids, but pretty much everything else they do. They don't do medications that require a parenteral route. And when I say parenteral route, I mean like IM, IV, sub-Q. They don't do those. They don't give insulin. They don't give anything IV push or IV piggyback. And they don't do any intramuscular injections. That all goes on the nurse. Medical assistants may receive a delegatory task from a nurse. LVNs and LPNs can also receive tasks from RNs. So with delegation, basically you're authorizing an unlicensed person to provide a nursing service while retaining the accountability for how the unlicensed person performs the task. Clearly, when we say unlicensed, we're not talking about LVNs or LPNs because they are nurses and they do have licenses, and CNAs and PCTs do have licenses too. I don't know why they call them unlicensed persons because they do have license. We went to CNA school for a short month, true, but we did have to sit for for written boards, and we had to perform skill boards. And we have license. We have an actual license. So I don't know why it's called unlicensed. But anyway, these delegation does not include situations when the person who is helping the nurse, for example, like assisting. If you're doing a Foley catheter and you have if you have a CNA come in and help you, you're not delegating that task. You're there, you're doing the skill, and you're having help. That's not delegation. we'll get into more later, like what delegation really is. So delegation autonomy. What does that mean? What am I meaning when I say delegation autonomy? Nursing is an autonomous field. Way in the beginning of nursing, nursing was regulated by physicians. Now nursing is a standalone field. We regulate ourselves. We define our own scope of practice. It's not something that physicians have any too much control over. So for that reason, delegation is one of those skills that we as nurses define for ourselves. We don't need a physician's order. We don't need a charge nurse's, okay, we can do these things as we see fit. It is important to know your facilities policy on delegation, because I know I read on the BON's website that a nurse can delegate vent care, trach care, oil suction, and trach suctioning. These may be things that a certain facility might say, this is not something a nurse can delegate. You have to do this. So you need to understand your facility's policy when it comes to delegating certain things. But typically, I think it's pretty much the same throughout all fields. But don't take my word for it. Check your facility's policy to be able to know what you can delegate. Autonomous nursing care is the ability of a nurse to assess and provide nursing actions as appropriate for the patient's care based on competence, professional expertise, and knowledge. The nurse is expected to practice autonomously, consistent with professional standards. So what that means is, yes, a nurse can delegate however he or she feels he or she should delegate, but you can't delegate tasks that you're not licensed to do, or you can't delegate tasks that require the nursing knowledge to do. The RN can delegate. RN's delegation is defined as authorizing unlicensed persons to provide nursing services while retaining the accountability for how the unlicensed persons perform the task. The BON does not require that RNs obtain a physician's order for RN to delegate, nor can a physician force a RN to delegate. The RN is accountable for the delegation process. Therefore, the decision to delegate belongs to the RN. So, once again, nursing is an autonomous field. We set our own standards. We set our own limits to what we can do and what we can't do under our own license. So it's up to the nurse to assess and decide what they're going to delegate and what they shouldn't delegate, what they should take on themselves. So just kind of looking at what things you need to pay attention to when you're getting ready to delegate. You need to assess the complexity of the task that is at hand. Is this a task that you really want to be delegating to someone else? Needs and stability of the patient. So, for example, if you're doing a blood sugar check, some things you're going to need is a glucometer. You can't do a blood sugar check without a glucometer. I guess you can draw labs, but we're not talking about that. So that's something that they may need. And stability. Is this a chronic condition? Is this long-term diabetes, or they're newly diabetic? If they're newly diabetic, you're probably going to want to do most of that care. You're probably going to want to do the blood sugar sticks. Something that I just found out during my research, that a nurse can delegate insulin administration to a tech. So it's important that in these acute situations where someone's just finding out they're diabetic, or they're having a diabetic crisis like diabetic ketoacidosis, you probably need to really pay attention more to the blood sugar and do the blood sugar checks instead of delegating that to a CNA or a PCT, or at least I would. Competency and scope of the staff. This is important because you need to know if this is going to be something that individual person is going to be able to handle, and understanding their scope. Nurses can delegate to a variety of people. So the way a LVN or LPN may react to a situation going wrong is different from a CNA, because LPNs and LVNs, they are nurses. So they have a little bit more nursing knowledge versus a CNA or a PCT. They won't really know how to react to a certain situation. So that's important for you to know. How much does that person know? What does their scope allow them to do? How far does their scope allow them to perform a certain task? Um, because that's going to play a role in the way that they're going to react if something goes wrong with the task that you delegated. Even the most careful person can make a mistake. So it's important to understand how competent the person is and what is their scope of practice. What do they know? What have they learned? You also need to understand the task and the potential harm. Like I said before, accidents happen. Even the most careful hand can cause an accident. So you need to understand the task and the potential harm so you can instruct the person you're delegating to of the things that they need to watch out for. And you need to be available. You need to assess your own ability to be available to that person if something should go wrong. If you kind of pay attention closely to the things that I've listed, these are the 5 rights of delegation. The right task, starting from the bottom, complexity of the task, all the way to the top, ability to be available. So starting from the bottom, the right task, the needs and stability would be the right situation, the right person, the right teaching, and the right evaluation. You're going to have to go back and evaluate these things. Once again, nursing is an autonomous field, so you define, do you need to go back every hour to assess their what they've done? Because remember, these things, if they do them wrong, they fall on you. So are you confident in their ability to do the task? Do you need to check it every hour, every 2 hours, every 3 hours? That's on you to decide. So now moving on to supervision. What is supervision? Supervision is to observe and direct the execution of a task or activity. So it's different from delegation because you have completely relinquished the task to someone else if you're delegating. Supervision, you're not relinquishing that task. You're still there. You're still watching and observing and critiquing the things that they're doing. RNs may be involved in patient family teaching. This is not delegation. The RN is responsible for providing complete and accurate instructions and oversight in addition to the client assessment. You're still required with delegation to provide complete and accurate instructions and oversight, but more so with supervision, do you need to pay attention to these things? Because typically you're teaching. Before you completely delegate a task to another person, you're going to have to supervise them. You're going to have to watch them do it and see if they really know what they're doing. You may supervise a CNA, a medication aide, or certified medication aide, or a medical assistant, LVNs. We can supervise them. Family members, you're going to have family members coming in, especially with people who are newly diabetic. If it's a younger child, you're going to have to supervise and see, can they give themselves this insulin? Does their mom know how to give them this insulin? You're going to watch over and see what they can do and what they can't do. Also, you're going to supervise nursing students. So that's something those are things that those are people you're going to be supervising. Assessing adequacy and frequency is all to the discretion of the nurse. Going back to the delegation, it's all up to you how many times you're going to reassess. It's all up to you if you see the person who you've supervised, if you're going to delegate that task to them. That's up to you. No one makes that decision but you. The BON does not issue specific guidelines for these. It's always an exception to every rule, and that exception is going to be insulin. My teacher project is not about insulin, so I didn't go too deep into it, but if you're interested, and at the end of my presentation, I do have the reference page, and I have linked the BON's website, so you can go there, and if you find rule 225.12, you can look more into that and see, like, what are those differences with insulin. So these, like I said before, the position of a certified nurse assistant is to be a nurse assistant. You're an extension of that nurse. That position was made for nurses. But that CNA is still a part of the healthcare team. So doctors sometimes may delegate to CNAs. They may delegate a task to them. Not a nursing task, but some type of task. I know often um, doctors may ask a nurse aide to do a certain task. For me, when I was working in a nursing home, other interprofessional people can delegate to CNAs too. PT would come up to me all the time when they, were doing their physical therapy and stuff like that with the patients, and they would say, "This is something that we want him to do, especially on weekends because PT isn't there on weekends." And they would, show me an exercise and say, "This is what we're going to do it. This is the proper way to do it," and do it once or twice a day with them when you have some downtime. This is important for a nurse to know because you're supervising at this point. You didn't delegate it, but you're still responsible for the care of that patient. You've established a nurse-client relationship. Therefore, you have a duty to maintain that patient's safety. Because of this, you, even though you weren't the one who delegated this task, you need to be adequately supervising the CNA when they're doing tasks that have been delegated to them by someone else from the interdisciplinary team. Because if they're doing these things wrong, you have to report to the doctor, report to PT or whoever delegated the task to the CNA, and tell them, "Hey, this CNA really doesn't understand it. You need to do some better teaching, or can you do some better teaching, or redelegate it to someone else, or whatever it is that you need to say or ask. This is what you need to do." The RN should verify the training, and the task can be done appropriately without putting the patient at risk. The task should not be done if it puts the patient at risk. And if the person who is doing the task isn't doing it in the way that is safe and efficient for the patient, the nurse should report this. This is a part of supervising. So, some things from my presentation that I really want to stick with you guys. I want you guys to really know these things. In nursing, delegation is a transfer of nursing privileges to another person while maintaining the legal and ethical responsibilities. The 5 rights of delegation: the right task, the right situation, the right person, the right instruction, and the right evaluation. They need to be assessed before the nurse can safely delegate this task to someone and send them off on their own to perform these things. Supervision is different from delegation. Supervision is the observation and directing to execute a task. The RN may supervise a CNA or LVN or maybe even a family member. Examples of a nurse using their delegatory autonomy is when a nurse assigns a CNA to draw. It says can. That must have been spell check. So I'll fix that. But when a nurse assigns a CNA to draw blood sugars, that is something that a nurse can delegate, or to do oral suctioning, which I found out. That's something that a nurse can delegate. They can delegate oral suctioning, vent care, oral care, oral and tracheal suctioning to a person that they deem fit. Once again, it's based on your facility's policy, though. So even though these are things that the BON says you can do, make sure you understand your facility's policy. So these are my references, and that's pretty much it. Thank you guys for listening to my teaching project. I'll be sending, along with the teaching project, a copy of the slides because I know I'm blocking this little bottom area off, so you probably couldn't see stuff. And I'm going to also send my assessment tool when I send the slides and everything to you guys. And once again, just thanks for listening to my teaching project. You have a good day.